What do you think?
Amazing. Amazing.
Kim Hayes of Seattle is an assault survivor who became an unlikely advocate for offenders like these. Seriously mentally ill people who didn't need a jail cell, but a hospital bed. And after several difficult years, the state of Washington made it happen.
Absolutely fantastic.
This is security video of Kim getting brutally assaulted 2 years ago at a Seattle light rail station. It made national headlines. The state deemed her alleged attacker, Alexander J., so mentally ill he should be transported from jail to a state hospital by law within 7 days. Instead, Jay got stuck at the King County Jail for nearly a year. Beds at facilities like Western State Hospital in Lakewood were full. In 2022, he was one of about 500 mentally ill inmates in Washington holed up in local jails. Today, that number's down to 15 people. And wait times for a bed have gone from 4 to even 9 months to just 5 days.
I think it's fabulous. I think that is one of the best outcomes, the best outcome that can happen for everyone.
These are the shortest wait times I've ever seen in 9 years in this position, probably even longer than that. And the other positive is we're showing that we're able to maintain this.
So you're saying it's not a fluke?
It's not a one-off, correct?
In her new series, Mentally Ill Waiting in Jail.
2 years ago, the King 5 investigators began exposing the unprecedented problem and fallout. Would you ever have imagined that in 2022 we'd be in this place?
Absolutely not.
I have anxiety.
Judges ruled DSHS was violating the civil rights of mentally ill defendants, as many of them decompensated in custody. Local jails were overwhelmed. Taxpayers were on the hook. A federal judge levied $200 million in fines against the state for violating her orders. Public safety was also at risk.
I simply can't continue to hold him.
Judges fed up with wait times let several people out. In one case, a man released from a Washington jail went on to murder a couple in Idaho.
And I believe all of our hearts are just broken.
And victims, like Kim Hayes, were left in limbo.
You're hanging on. Okay, can he go back to trial?
Is he going to be released?
Is he going to be released?
How did they do it? How did DSHS move hundreds of mentally ill inmates out of jails like King County's here in Seattle? Last year, they made a bold and sudden move. They asked the legislature for $90 million to buy an old hospital, renovate it, and staff it. And it worked. Governor Jay Inslee cut the ribbon last year on the new facility in Tukwila, Olympic Heritage Hospital.
Oh boy.
In October, the state moved 70 patients from facilities like Western State into Olympic Heritage, freeing up those beds for people waiting in jails. And they did it
currently under construction
from purchase to move-in in less than 2 months.
I can't think in almost 30 years of state government of a project like Olympic Heritage that has been as aggressive and as speedy.
More projects got put on the fast track. In the last few months, DSHS moved 60 less acute patients into newly renovated treatment units at what's called Maple Lane near Centralia.
Well, this is my room. It's pretty cool.
Residents told us the new setting is helping them with a more inclusive, less sterile place to live and get better.
It's really friendly and inviting, and especially with the open windows and stuff, like big windows. And you don't see that in other facilities. Other facilities are more like jail. Yeah, it's cool.
Administrators who have taken their lumps the last few years say it's a welcome day to be showing results.
Thank you so much.
There has been just like, okay, what do we do now? But to have you standing here today to just see and hearing about some of the great work that we're doing, it is a positive thing that we're doing for DSHS.
You're coming to or from work?
I was coming to work.
Last week, we went with Kim as she went back to the light rail station for the first time since her attack. So what is that like for you to be here?
It's okay.
The assault was 2 years ago.
It did take you a while to ride light rail, didn't it?
Oh, God, I didn't. A year and a half.
During that time, she used her voice for change.
It does take away your belief in the system.
She never stopped speaking out or attending court hearings about the case.
But I did not want to hide in the shadows. Oh, I've got to make something out of this. It was a bad situation. I mean, that's why I called you. I was like, can you help me with this? And let's figure out something that gets this out to people.
DSHS officials say there's more work to do. It's no time to rest on their laurels because demand remains high. The need in this population for behavioral health treatment has skyrocketed in the last 6 or 7 years, and they say they're working on ways to improve that as well. In the newsroom, Susanna Frame, King 5 News.
The King 5 investigators are dedicated to serving the public interest through watchdog journalism. If you would like to submit a tip to our team, send an email to investigators@king5.com.